Let's bring into the conversation Dr Azhar Zafar, a GP, and also researcher Chris Thomas, who's head of the Commission on Health at the Institute for Public Policy Research. Thank you both for coming in. Doctor, let's start with you on this one. I mean, it seems to be an impasse, doesn't it? And every day we hear more and more of the growing numbers of people on waiting lists, and every day we imagine how much they must be suffering.
Yes, you're right, because every time they go on a strike, even in general practice, we suffer because we have the postgraduate doctors with us. When they go out on a strike, we have to scale down our services on the day demand, which is quite a priority from the health department, that we have to provide more than 50% of our appointments to meet on the day demand. If we scale it down, the people need to go to A&E, and then they have to wait there for hours. So I think it's all stemming up from there.
But you yourself are a doctor, you're a GP. So does this mean that you don't feel that your colleagues are justified in striking, that you wish that they wouldn't and you don't want them to? Or how do you feel about their complaints about paying conditions and the difficulties about recruitment and retention?
So I think in terms of whether the strike is justified or not, I will not be in a position to comment on that, because they are colleagues and they're doing it from a BMA platform. They have a justification in terms of what their demands are. When I was a junior doctor, my working hours are a bit longer. I was doing about 60 hours and I was being paid more than what they're being paid. So that is a different debate. But overall, whenever they go on a strike, the services do suffer, primary and secondary care both.
Does that mean you don't agree when they say they can't continue the way they are, that they're effectively earning much less than they originally were, and that they are being, offered enticing jobs as nearby as Ireland, as far away as Australia, and they're going to take them if we don't make some kind of difference?
I think if you compare from the other countries, and that is again my personal opinion, the other countries, they pay junior doctors more than what we do. And then to retain them, we have to negotiate. We have to sit down with them, as my other colleague said, because negotiation is always the best option. So we have to reach and conclude this matter, because it's going on for a good few weeks now, months now.
So what are you on this programme to say? What do you want to say? Are you on to express solidarity with your fellow doctors, but say, although you admire and respect them, you don't think they should strike because they're increasing the waiting list? Or are you on to say you do think they should strike because their conditions are untenable? What do you actually want to say about this?
Being a professional, I will support my junior doctors, what they're doing.
You do support them?
Yeah.
You support them in striking, even though what you're really saying on the programme is that the waiting lists are getting longer and longer. You still support them.